The asbestos issue is not a thing of the past. It continues to this day.
We want to end this man-made disaster.
So let's ban asbestos.
But tell me how you're feeling. How's your own case doing?
I have the peritoneal form of mesothelioma, so I've been through 4 surgeries in the last 10 years. I'm certainly doing better than I expected, and I am facing more surgery. I don't know when. I've tried an experimental chemo in the last year that didn't have an effect, and so I know that the only option for me eventually is another surgery. I have probably a dozen detected tumors throughout my abdomen and abdominal muscles. Some of them are in very difficult to reach, risky places, so they're growing fairly slowly. So we're planning not to do anything until they pose some symptom or some hazard to me. So, but other than that, I feel great.
So what advice would you give to someone who's gotten newly diagnosed?
You know, I talk to newly diagnosed patients occasionally. They get kind of referred to me by either an attorney or a doctor, and I tell them what I've always told people: you have to take this fight to the cancer. You have to educate yourself as much as possible if you want to survive. You have to understand what the disease is.
So it's the 10th anniversary of ADAO. What do you think about how far 10 years? What's
My
happened
goodness.
In 10 years and how far they've come? And
You know, I think back to that first meeting, and it was not long after I'd had my initial treatment, and those were days 10 years ago when the median survival for peritoneal was measured in a few years, and many of the aggressive ones were just not treatable at all. Now I think it's changed considerably. I know other people that have survived for surprisingly long times. You know, when I was diagnosed, my doctor said he'd never heard of my disease until I got it, which is why I went 6 years without diagnosis until it got critical, and then they finally figured it out.
do you have any message for ADAO or Linda on their 10th anniversary?
Just to congratulate them on a lot of hard work and a lot of good results, and wish them well in the next 10 years. Maybe we'll be at the end of that battle and have all the rights assured and the money for research and improved cures and all that kind of thing that we're searching for. So it would be nice to think that.
The asbestos issue is not a thing of the past. It continues to this day.
We want to end this man-made disaster.
So let's ban asbestos.